Hi, I'm Dr. Mayavedamurthy with 35 years of experience in dermatology. I'm a consultant at RSV Skin and Laser Center and in Apollo Hospitals, Chennai. I'm going to share some facts about psoriasis. Psoriasis affects 1 to 3% of the world's population. It can affect all age groups and affects both men and women. Psoriasis can occur in two peaks of life. One is between 17 to 22 and the other is between 57 to 30. Although it can occur at any age, at any point in time. There are several factors which can precipitate the onset of psoriasis. Most important is infection. Any streptococcal infection can precipitate psoriasis, and stress in life can also precipitate psoriasis. And it can also be due to drugs taken to several other causes like lithium, which is used in psychiatric medication. It can be followed by antihypertensives, and also some diseases like associated with diabetes, obesity, depression. So there are several forms in which psoriasis can appear on the skin. It can appear as small papules and plaques, and the small papules are also called as guttate psoriasis, which is common in children following respiratory infection. In adults, you have different varieties of psoriasis. We have the plaque type, which is a commonest type, which occurs as silvery scales on an erythematous background, and it can affect all parts of the body from head to toe. It can also present as pustules when it is called pustular psoriasis, or it can occur as a generalized erythematous form, which is called as erythrodermic psoriasis or exfoliative psoriasis. Psoriasis can be confined to certain parts of the body also. Like it can be confined to the scalp, when it's known as scalp psoriasis. It can also affect the palms and soles, which actually can interfere with the quality of life. And sometimes it can affect the nails also. So you can have a combination of pictures, and they can also present in different forms. However, there are certain clinical signs which gives a clue to the fact that it is psoriasis. One is Kubner-ization, which occurs at the sites of trauma. You get similar lesions occurring along the sites of trauma. And another one is called the Grattage sign, which is also called the Auspitz sign, and this can be demonstrated by your dermatologist. So when a person gets psoriasis, it doesn't mean that the disease is affecting only the skin. It can also affect internal organs because of the chronic inflammation that occurs in this condition. Because psoriasis, if you see, is a chronic inflammatory disease of the skin. And this inflammation can lead on to myocardial infarction, which is heart attack, and it can also precipitate stroke in these individuals. And this can lead to other systemic complications, like it can involve the kidneys, it can involve the joints, it can be associated with the dyslipidemia as well as diabetes. And there are also other autoimmune diseases which can be associated with psoriasis. So a patient with psoriasis needs to be investigated. And there are some triggers, like climatic conditions, like psoriasis can occur or get exacerbated in winter. It can get exacerbated due to periods of stress and even obesity. So there needs to be a dietary modification for patients with psoriasis. So treatment has to be done with the help of dermatologists, because it has to be a holistic approach. It starts with lifestyle modifications, where a person needs relaxation, where a person needs dietary advice because they have to increase the omega-3 fatty acids in their diet, and take all forms of measures to prevent weight gain, because obesity is related to increase in the severity of psoriasis. And again, one has to have a good amount of moisturization, because dry skin can actually worsen psoriasis, and therefore they need to use moisturizers all the time. And another thing they have to follow is topical application given by the dermatologist, because topical application alone is sufficient for small limited areas in the body. When psoriasis occurs on larger areas, or when there is associated comorbidity or joint problems, there are several drugs which one can be prescribed. The commonest ones are usually disease-modifying drugs for treating severe forms of psoriasis. And phototherapy is one of the best modalities of treatment. And when all the conventional treatment fail, we have newer drugs called biologics. There are different types of biologics, like you have the secukinumab, you have the infliximab, you have the etanercept, and we also have exicizumab. Although there are several other biologicals which are there in the pipeline and will soon be available for these patients. So in short, treating psoriasis as early as possible can prevent complications and comorbidities which occur with this skin disease, and your dermatologist is the best person to give you the holistic approach, and therefore make sure that you meet your dermatologist as early as possible and be free from the comorbidities or the complications of psoriasis.